So the pink canary is my nod to the canary in the coal mine. So when we are losing desire, arousal, and I look at this as a pleasure problem. So in and out of the bedroom, right? If we're not feeling alive, fulfilled, turned on, we're not just talking about sex, we're talking about life, that vibrancy. If we're losing that, we're losing desire, then that's a warning light, a signal of health problems to come. Because this is a massive problem in heterosexual relationships. And I don't care how much vaginal estrogen we put on or how much testosterone you take, it will not fix the desire or the arousal if you don't like what's on the menu. Why is it in heterosexual relationships that men reliably orgasm and women don't?
Welcome to the Hope Natural Health Podcast. I'm Dr. Erin Ellis, your host. On this show, we discuss all things health, hormones, and happiness with a little side of this thing called life. Today's guest is Dr. Jordan Wiggins, a naturopathic doctor, women's health educator, and founder of the Pleasure Collective. She teaches high-achieving, successful women how to be as badass in the bedroom and relationships as they are in business. Dr. Wiggins focuses on helping women understand the deeper physiology behind libido, hormones, and nervous system health, especially in a time when so many are told their labs are normal, but still don't feel like themselves. Her work brings attention to what's often missed in conventional care, how chronic stress and a dysregulated nervous system can directly impact desire, energy, and hormonal communication. Through her clinical work and education, she helps women reconnect with their bodies, understand what their symptoms are actually signaling, and rebuild a sense of safety that supports true healing. Welcome to the show, Dr. Jordan.
Thank you for having me, Dr. Erin.
I'm very excited for this chat. Libido is a big topic in my practice. But before we dive into that matter, why don't you tell us a little bit more about why you became a naturopathic doctor and how you focus, on libido and hormone optimization?
Well, talking about why I became a naturopath will be exactly why I do this today. Although being a pleasure doctor or learning about libido and having that be the focus was never the plan. But here we are. When I was 18 and I went on birth control, I got my period for 3 weeks every month. So I had underlying hormone issues, and I was just told, oh, try this different pill, but you need to stay on it for, 3 months to see how each one works. So I basically had my period for an entire year, and then I was anemic and just depressed and and definitely had no libido at that point because I felt so terrible. And I also had Bartholin cysts that I had operated on. So I had stitches in my vagina before I even was sexually active. So kind of like an episiotomy, you can think of it as before I'd even had sex or had a baby. So I had pelvic pain, but I didn't know that it was pelvic pain at the time. It was misdiagnosed. I had a sports medicine doctor tell me that I had torn my obliques off my iliac crest. I'd had a gastro tell me that it must be in my head and maybe like I should be referred to psych. And it wasn't until I was in school becoming a naturopath because I thought I never want another woman to feel like as alone or as unsupported as I felt growing up with my health and how, shameful it was because it was a vagina. So that's why I became a naturopathic doctor. And then just because of the hormone issues and the pelvic floor pain and the libido issues, that was something that I guess patients started talking to me about. And I'd had questions on my intake form from the very beginning of my practice that was, are you enjoying the sex you're having? How are things in your relationship? I've had questions around that because I felt like it was something that we deal with everything else first. And that always gets pushed to the side, especially for women.
Yeah, so true. I mean, that kind of leads into my first question, which is how you describe libido as the pink canary for women's health. So, can you explain a little bit more about what that means and what it's signaling when desire starts to disappear?
Yeah. So the pink canary is my nod to the canary in the coal mine. So when we are losing desire, arousal, and I look at this as a pleasure problem. So in and out of the bedroom, right? If we're not feeling alive, fulfilled, turned on, we're not just talking about sex, we're talking about life, that vibrancy. If we're losing that, we're losing desire, then that's a warning light, a signal of health problems to come. And I was realizing through working with thousands of patients at that time that we're all describing the same thing, which was anhedonia, the inability to feel pleasure and joy. And it is a diagnostic criteria of major depressive disorder. But my patients, like, they weren't really meeting that diagnosis. Some of it fit, but they were very high functioning, holding it together at work, at home, with their kids. So I started to really look into, why is this happening? And in a nutshell, for your listeners, when we lose that arousal, that desire, like that's when we know we're safe, we're secure, when we have the ability to be turned on. But when we're stressed out, we're overwhelmed, we're doing everything for everyone, we feel like we're putting out fires all day long, and we're in that survival, fight, flight, fawn, freeze mode, we can't access our arousal or turn on. So we know that if we live with cortisol dysfunction, adrenal dysregulation for years, we know that we're going to have adverse health outcomes and chronic disease. So to me, we can sort of look at that, our turn on, as a warning light for that, for things to come.
Yeah, so true. It's never just one thing, right? Like a lot of people just associate libido and arousal with like, oh my gosh, my hormones and testosterone. It's like, it's a little bit more than that, especially when, not
And
always that's deficient, right?
yeah, and that was what was the fascinating part, because graduating and you think, okay, I'm going to do functional medicine testing, we'll prescribe the right hormones, everything's going to be good. But sometimes you'd come back and they'd actually have optimal hormones
Mm-hmm.
on blood work, and they're like, but I thought you were just, I thought I just needed some progesterone and estrogen and testosterone and I'd be back. But it
Mm-hmm.
it wasn't that way. And I find that it's really, and this is my experience, and I find that social media really overstates the benefits of hormones. It's like, take testosterone, it's going to fix your libido, your mood, like these silver bullets, right?
Mm-hmm.
And then patients were sort of feeling like there was something wrong with them, or they were broken, or they couldn't, like, they were inherently unfixable because the hormone replacement therapy didn't fix their
Mm-hmm.
libido. But it was much more complicated than that.
Yeah, so let's talk about the nervous system and how that is playing like the central role in libido. So what's happening physiologically when the body is stuck in that more survival based state?
So when we're in that survival state, fight, flight, freeze, fawn, we we're focused on survival. We are not focused on reproduction. And they've actually done MRIs to show that the pleasure centers in your brain are off, or they're far less responsive when we're in that survival mode. So, especially women, they feel like there's something wrong with them.
Mm-hmm.
Like, well, why? I don't care if I ever want sex again. And the only reason why they wanted it is because it was important to their partner, right? They
Yeah.
could care less. That's how shut off their pleasure centers were. And you know, like, I don't know why I can't just want it. They want to like think their way, force their way, just get through it, check the boxes so it's done. But really, their body's doing what it's designed to do. It's quite smart, actually, and it's designed to protect us. So when those pleasure centers are off, touch doesn't feel as pleasurable. You won't have an orgasm that is as good. Usually people say like their partners give them the ick if they come even close to them, or
Mm-hmm.
they start getting stressed out around bedtime because they just want to read
Yeah.
or they just want to relax, right? There's like, don't, he better not want to come have sex with me because I just want to relax. Well, probably if she had time to read and take a bath and get out of that survival mode and into her parasympathetic rest, digest state, then her turn on would be more accessible because the pleasure centers are on.
Mm-hmm.
But the issue is that it's usually like so late and she's so
Mm-hmm.
exhausted that she doesn't want to have sex. But it's not a her problem, right? And what do we tell her? Relax, have a glass of wine, get some lingerie, plan a date night. Like, we say all the, and my clients still and patients still get this messaging sometimes from gynecologists or people in the medical profession, therapists, where they're sort of blaming her or diagnosing her. So 1 in 2 women globally has sexual dysfunction. I believe that's an underreported statistic, but issues with desire, getting aroused, staying aroused, difficulty orgasming or not being able to orgasm, and pain with sex. So it's a pretty wide umbrella of terms to say that, 1 in 2 women will have sexual dysfunction, but I've ticked all of those boxes at some point in my life, right? Postpartum, perimenopause. So I think it's personally very underreported. But we're quick to diagnose, we're quick to label, even HSDD, like to say, oh, hypoactive sexual function disorder, like it's her fault. Okay.
Mm-hmm.
And even when I wrote my first book, The Pink Canary, I was looking at it very individualized, like very medical, right? Like, look at the patient in front of me and how do I, you know, diagnose, assess, treat her. But then, and this is why I'm writing the sequel, because it's even bigger than that. Because I think before we diagnose, before we give those labels, we need to look at the relational system that she's functioning in. And is that safe? Does her aura ring tell her that, she's more relaxed when her partner's around, or does she get more anxious when she knows he's coming home? Does she feel supported? Does she feel seen and heard? Or is she like the caretaker for everyone in the whole family system and everyone's emotions, right? So I think we need to take even a step back further and look at the relational system and also be asking her, like, are you enjoying the sex that you're having? Because this is a massive problem in heterosexual relationships.
Mm-hmm.
And
Yeah.
I don't care how much vaginal estrogen we put
Right.
on or how much testosterone you take, it will not fix the desire or the arousal if you don't like what's on the menu.
Mm-hmm. What about for those women that like what's on the menu, but they don't they don't like themselves. Like they don't feel comfortable in their own skin. Maybe they've put on some weight and they're just not like they don't want to get naked, right? Because they're embarrassed with how they look. What what are
Yeah.
your thoughts
I
on that?
think that it's a big concern because there's women that they won't even want to have sex unless they're showered or
Yeah.
waxed or like we have all of these beliefs, and I think a lot of it is pressure put on us by the media, right? That we should look like teenage girls or or younger, or else we're not sexy or worthy of love or pleasure. And some of that's a whole other conversation with what's going on in the world right now, but it has a lot to do with safety and desire and arousal. Desire is context dependent for women, especially. And our I work through this in a lot of my programs, and I'm trying to summarize, but they are bigger concepts. We're working through that we're worthy of pleasure and feeling good because we exist.
Mm-hmm.
Okay, but that's not what we're taught, right? We're taught
Mm-mm.
that we have to earn it. We have to get
Mm-hmm.
the items crossed off our to-do list, and then we can relax, and then we can feel good. And we
Mm-hmm.
need to lose the 10 pounds or whatever before we're sexy again. Like we need to get the baby weight off. So it's all beliefs that are in the way of our pleasure, and they're put there by design. And once again, that's a bigger conversation, and we get to decide, like, do I do I want those beliefs to interfere with me feeling good?
Mm-hmm.
And it's not that simple, but we're going to still, like, our nerves don't change,
Yeah.
our nerve endings, our ability to feel doesn't change, right? Like, we're not talking, because I've even worked with people that have had accidents or surgery or damage to their bodies where things feel different. But this is just literally where our mindset and the context is in the way. So how does each individual person frame it?
Mm-hmm.
And most of my clients, when we stop and we think about it, I have them do handouts about their best sexual experiences, their worst, their desires, and then we're kind of like putting it all together, and they're realizing that sometimes, like, they weren't showered or they weren't at their best. They felt like, what are their contexts for pleasure? And
Mm-hmm.
sometimes they feel safe and supported, or sometimes it was more of like a chance quickie or a little encounter. But when they find their own formula for turn on, then sometimes the body image issues are less, like, prominent. They're
Mm-hmm.
probably still there. I don't know a single person
Yeah.
that doesn't
Right? We're
have
women.
sex and think like, oh, is my fat in the way there? Like, or how am I
Right.
looking right now? Like, it's so deeply rooted. But if we have a process of, like, coming home, finding the sensation, right?
Mm-hmm.
Because to me, I'm like, I'll be damned if I let this patriarchal conditioning get in the way of this orgasm. Like, no, thank
Yeah.
you.
Yeah. Um, so we've talked a lot about nervous system and when the hormones start to fall out of alignment. What are some early signs that, if you're in your late 30s, 40s, that this might be happening, even if like nothing really looks wrong on paper?
So if you could orgasm and then you can't, is a big warning sign. Pelvic pain or discomfort during sex, like issues with getting lubricated, staying lubricated. And I mean, thankfully, with them removing the black box warning on estrogen in the US, I feel like it's opened up a lot more conversation and more women are willing to take hormone replacement therapy, which is amazing because then we can prevent
Yeah.
genital urinary syndrome of menopause and do a lot of good for women's health in general, but also
Mm-hmm.
their sexual health.
Mm-hmm. Yes.
Remind me of the question. Sorry, this is my
No, it
third
was just
podcast I've recorded today.
oh, you're fine.
Third guesting one too.
The early signs of the nervous
Oh,
system and their hormones, like with their nervous system and their hormones like starting to fall out of alignment.
so the early signs, even before hormones, I see it's more like adrenal signs. Like we're not sleeping through the night,
Mm-hmm.
we're getting that energy crash midday. I see that, like that, those burnout signs, those cortisol
Yeah.
signs seem to happen for years before I see the hormone issues. Because I always look at hormones as a lag indicator. And it doesn't mean
Mm-hmm.
that we don't treat it and that there's not amazing benefits from hormone replacement therapy, but lots of things were going wrong for
Before.
years before that, right?
Yeah. Well, just like you said, it's probably, the adrenal dysfunction, which I mean, in this state of our life, who doesn't have that, right? Everybody does. I mean, stress is probably the root cause to so many different health conditions, and that probably escalated the hormone dysfunction,
Exactly.
right?
Yeah, that's exactly what I've seen in my
Yeah.
practice over the
I just
last
saw it
11 years.
I just saw it yesterday in practice, and I was like, okay, well, we know that the underlying culprit here is this stress, and it just sucked the life out of your hormones because she was doing really, really good. And the only thing that changed was a high stress time when everything started to shift and she regressed. And I'm like, okay. And then we look at data and we look at her aura ring, and I'm like, well, there you go. You're in this state of fight or flight, and we got to get you out of it because it's sucking the life out of your hormones, and it's not going to do me any good to just give you more when we
I
haven't
know, but
fixed
that's
it,
always what they want, right? Oh, well, this
right?
helped. This helped initially. So can we just up the double it? Can we just up the dose?
Yeah, I mean, I've said it multiple. We can't out supplement or medicate stress. You can't,
No,
and it's literally
no.
like, I bet you if anyone just took anything out of it, out of this conversation, that your libido concerns and desire concerns, I bet you have a huge part to do with the amount of stress you have on in your life. And just like you said in the
Yeah.
beginning, it's like, I just want to read. I just want to take a bath. You don't, that's the last thing you want to do when you're stressed and exhausted is be intimate.
And be intimate as a performance for somebody else. Because then it really does feel like another to do list item.
Right.
But I have women that have done that for years.
Yeah.
Like,
Yeah.
oh, I'll
It's like
just
another chore.
have sex. So, exactly. But it really erodes the intimacy in a relationship.
Yeah. Yep. For sure. So if we have this nervous system dysregulation and we need to restore that parasympathetic tone, the more rest and digest, what does that like really look like in real life for busy women? And where do you typically start with your patients?
So, my patients generally have super traits. So, I don't know if this happens to you, but you get patients that are a lot like you,
Mm-hmm.
like they're mirrors of you in certain
Mm-hmm.
ways. So, super traits, this is initially Sandra Brown's research. I've modified it to work with my patient population, but it's women that rank higher than average on certain characteristics like empathy, loyalty, hard work, tolerance, forgiveness, responsibility. And when that is our mode of operating, we are, even in a stressed out state when there isn't really stress, because we are taking over responsibility for things. We're the manager of the household. We're over functioning in every single aspect. So what I've noticed with my clients and patients is that we can say, meditate, take walks, do somatic practices, listen to your isochronic tones at bedtime, like do all these things to reset your nervous system. But it's all, again, like performative checkbox band-aid type fixes. Take a vacation, or, just I didn't feel like I was actually fixing the root in my earlier work of the pleasure problem. I didn't really know what the root was 6-7 years ago. But what I'm realizing is that women, high achieving women with super traits, need to first and foremost be able to center their own pleasure and put themselves first, or at least on the map, when it comes to their desires and what makes them feel good. So I have them start doing that through pleasure practices. And I have a pleasure practice guide of 50 ideas that I can give your listeners the link for somewhere to start. And some of the stuff, the basic stuff, is like things that we would do on our own that don't require anybody else. But as we're kind of graduating to be able to center our own pleasure, then it's things like you're picking the restaurant and you don't care that it's not everyone's favorite. Like they're all going because you want to go. And things, so that's like out of the bedroom. And then in the bedroom stuff, knowing what you want and being right, when we were talking about, like, if we don't like what's on the menu, and in the thousands and thousands of women that I've worked with at this point in heterosexual relationships, like they're not even, they've just done appetizers. Like they haven't even really looked at their depth and erotic capacity and what really turns them on. They don't even really know what kind of touch turns them on. So learning and discovering those things is one step, but actually being able to receive them and ask for it, it's a whole other thing. To be able to say to your partner, honey, I want the focus to be on me tonight. And don't stop until I've had 3 orgasms. Thank you. Like that is mind blowing to a woman with super traits. Like 3 orgasms, is that is that a thing we're doing, or is it focusing on me and my pleasure? Is that, like, it is so foreign. And that's why, well, really it comes back to sexual health education. And I do write about this in the Pink Canary. We're taught reproductive health, right? Penis and vagina, and like, don't do that because then it's going to make a baby or give you an STI. But that's sort of what we're taught about sex. Or a lot of people grew up watching porn for their sexual health education. And a lot of male directors, right? Like it's very penetration focused, and only 1/3 of women reliably orgasm from penetration. So like we've got the orgasm gap in heterosexual relationships too, to deal with, even though women have a much greater orgasmic capacity than men. So why is it in heterosexual relationships that men reliably orgasm and women don't?
Yeah.
because we're doing the for men's pleasure
Yep.
sex,
Yeah.
and we
No,
don't
so
even
true.
know it. Like, it's so ingrained, even in movies, right? You see, like, they kiss, and then maybe there's some oral, and then there's penetration, and then there's mutual orgasm, and that's just like our sex script, and it is so boring. And I think it's relying, like, why we have sexual dysfunction to the degree that we have. And we shouldn't
Yeah.
be diagnosing women, we should be teaching them.
Yeah. Another thing we're not taught. We're not taught how to have sex.
No, we don't. That's sort of ended, like, with the Pleasure Collective and that second
Yeah.
business that I created. It's how to have sex, and basically how to create a pleasure centered relationship,
Yeah.
which is where, like, it's mutually beneficial for both people.
Yeah.
Because most of the women that I work with, they have their super traits. They're the overfunctioner. They're really, like, they're paired with an underfunctioner that feels more like a child or somebody to manage. And then once again, they're blaming themselves of, like, oh, why don't I want to have sex? Well, you don't want to have sex because you're caretaking for
Yeah.
somebody. You're supposed to do that for your children, not your partner.
Mm-hmm.
So she never feels safe, and like her pleasure centers are turned on in those type of relationships.
Yeah. So true. Great, great insights here, ladies. If you've learned something, I hope you did. Um, we'll wrap it up with one question I ask all my podcast guests. What would be your best or favorite health tip that you can share with the audience?
Have an orgasm a day.
I love that. That's a
But
good
if
one.
that
No one's
feels
ever said that.
overwhelming, start with like one or two a week. No, the
There
health
you go.
benefits are amazing.
Yeah.
Better mood, better immune function, keep our pelvic floors healthy, like less prolapse. The benefits of orgasm are endless.
Yeah, there's
Hormone
nothing wrong with it.
balancing.
There's
Yeah,
nothing
and why
there's
aren't
no
we starting
nothing
with that
negative
as
that
an
can come out of it.
intervention?
Yeah, there's no bad side effects with an orgasm.
No, I love that. I don't even think I've ever put it that way. I love that.
That's like a medicine that keeps on. I mean, there's nothing. It's like drinking water. Can't go wrong.
Love it.
Well, you have a Substack that people can subscribe to, where you publish some longer clinical analysis on the patterns that you see in practice. And you also have a podcast, The Pleasure Principles, which breaks down the science behind all of this really in plain language. And you mentioned The Pink Canary is a book that you have published. Is there anything else that we should know? I'll also include this link that you mentioned for the ideas
Yes, which is
in the
on
show
my
notes.
Substack, but yeah. Yeah,
Okay.
the
Yeah.
pleasure
Is there
practices
anything
for
else that you
sure.
want to share?
No, and I'm on Instagram
Okay.
at
Yeah, we'll make
Dr.
sure all
Jordan
that.
Wiggins if you ever want to send me a DM.
Yeah. Awesome. Well, it's been a pleasure speaking with you today. And I know my ladies that listen will gain some great insight here and hopefully take some of this to heart and put it in motion. But I appreciate your time being on the show.
Thank you so much for having me.
That's a wrap, everyone. We'll see you again next week.